Let me start by saying that reflux is one of the most common conditions in the general population. More than 50% of the population will at some point suffer from reflux. People who are obese have a higher risk of suffering from reflux compared to people who are slim. Now, as far as weight loss surgery is concerned, reflux can occur in some patients. For clarity, we are talking here about patients who didn't have reflux before the operation and who developed reflux after the operation. Some operations carry a higher risk of causing reflux, and this is especially the case with gastric banding and sleeve gastrectomy. Having said this, reflux can also occur after gastric bypass surgery, but the risk is a lot lower. It's less than 5 to 10%. Some patients will develop reflux after an operation because they had a pre-existing hiatus hernia. It's therefore important that the surgeon looks for hiatus hernia and repairs this when doing a weight loss procedure. In the first instance, it's important to stick to healthy eating habits and a healthy lifestyle. People should eat small portions. They shouldn't drink when they eat. They should not eat a meal before bedtime. This is a common mistake. People can eat late at night, and then during the night they suffer from bad reflux. So avoid meals late at night. People also should avoid certain food types and certain drinks, and it's especially important not to smoke. Mild symptoms are usually treated with medication, and quite successfully. A lot of these medications can be bought over the counter, things like omeprazole or lansoprazole. There are certain food types that actually can give acid reflux. And in the first instance, I would mention alcohol and especially red wine. So for the wine lovers, weight loss surgery is maybe not the best idea. Other things to avoid are black peppers, garlic, onions, spicy food, curries. There are other things that can contribute to reflux, and these are chocolate, citrus fruits, any citrus drinks, coffee, tea, peppermint, tomatoes. There's quite a long list. And when you hear all this, you think, oh, what can I eat? But there's plenty of good food that does not cause reflux. Mild reflux symptoms after weight loss surgery can usually be treated successfully with medication and with dietary adjustments and with lifestyle changes. I already mentioned that smoking is very bad, so give up smoking if you do. Severe symptoms or really bad reflux that do not respond to simple treatments usually needs investigations. And these investigations are required to find out why these people have that bad reflux. And those investigations can actually lead to the conclusion that a revision or a conversion may be necessary to fix the problem. People should see a doctor when their reflux symptoms do not settle with simple measures or with over-the-counter medication. GPs will often trial anti-acid medication like omeprazole or lansoprazole, and when that doesn't help, the GP should refer the patient back to the bariatric surgeon. And the reason for this is that there may be specific anatomical reasons why a patient suffers from reflux, and when these reasons are identified, an operation may fix that problem. It's also worth remembering that severe acid reflux can lead to damage in the esophagus, and that can lead to a condition called Barrett's esophagus, which is a precancerous condition. Although it does exist, and it has been seen in patients who had weight loss surgery, it is extremely rare, but nevertheless, it's better to be safe than sorry and seek help when you need it.